Hi everyone, I'm Dr. Karishmakagodu, certified plastic surgeon in Bangalore, and today we're going to discuss about blepharoplasty, also known as the eyelid surgery. Blepharoplasty is usually done for cosmetic changes around the eye. Now these cosmetic changes could be in the upper eyelid or in the lower eyelid, and usually they are concerning either excess skin in the upper or lower eyelid, also sometimes puffiness in the lower eyelid, fat bags in the upper or the lower eyelid. Most often patients coming to us looking for an eyelid surgery are usually concerned about the appearance in the periorbital area, that is in the area surrounding the main eyes. Remember, blepharoplasty surgery is not an internal surgery. That means we are not going into the internal side of your eyes. All of the surgeries are performed only on the external side of the eye, only involving the skin in the upper and lower eyelid or the fat bags around the eyes. So in no ways we are actually going internal. These patients are usually concerned about excess skin, and this excess skin is usually seen hanging from the upper eyelid, and the excess skin almost reaches their eyelash line. And sometimes in the lower eyelid, the excess skin is so severe that they create wrinkles and creases in the lower eyelid. Sometimes they only complain of puffiness or under eye bags. Now, these problems can be tackled with a blepharoplasty. Patients who usually come to us looking for an eyelid surgery, there are a few details that we need to ask about you, and the common questions that we ask you is that, do you have any internal eye disease? Any issues with the vision? Is your vision normal, or do you have problems? Do you have any dry eyes? Do you have any allergies to any medications? Have you in the past undergone any other eyelid surgery or any internal surgery related to eye diseases? Coming to the upper eyelid blepharoplasty or the upper eyelid surgery. Now most people complain is the excess skin in the upper eyelid. Now this excess skin sometimes actually hampers their vision. That is, the excess skin is hanging over the eyelid so much, it is creating a heaviness over the upper eyelid. And because of this heaviness, they have problems sometimes reading, watching television, or performing their normal activities. So usually it is the excess skin that we deal with an upper eyelid blepharoplasty. We make a very fine cut along the crease in your upper eyelid. Now most of us already have a very deep crease, and this crease is very evident when you close your eyes. So the incision which is made is really not visible from the outset, and it is hidden within the eyelid crease. And through this incision we remove the excess skin. We will measure pre-procedure how much of excess skin do you have, and this procedure is performed under local anesthesia. So we measure the amount of excess skin that you have in your upper eyelids and very restrictively remove this upper eyelid skin. Few people also complain of certain fat bags. Now these fat bags are present around the upper as well as the lower eyelid. In the upper eyelid area, the fat bags are usually towards the internal side, sometimes in the middle, sometimes towards the side of the eyes. Now along with the excess skin, the blepharoplasty also involves removal of these excess fat bags. So through the same incision, we remove the excess skin as well as remove the excess fat bags. The upper eyelid blepharoplasty is performed through this very fine incision, and usually we remove the stitches within the 4th or the 5th day. This incision is hardly visible, and within a week you can actually camouflage it. There may be a little redness and bruising. This redness may be more prominent in those who have very fair skin or Caucasians, but usually in darker skin individuals, the bruising and the swelling will be very minimal. The bruising and swelling last for about 1 week to 10 days. Within 5 to 6 days, you can start putting on your eyeshadow and your makeup. For women, it is much easier. They can camouflage it with makeup. For men, it is sort of difficult, but we always say that you can wear sunglasses and go out after the 3rd and 4th day and cover the incision. Let me tell you, the scars are absolutely least visible because we make sure we put the incisions or the cuts in the areas which have creases already existing. So in the upper eyelid, you can see we already have an existing eyelid crease, and in the lower eyelid, just below the lashes, you can see a fine existing line. It is called the gray line. So within this natural crease that we already have, that is where we make these incisions. Let's move on to the lower eyelid blepharoplasty. What are the concerns? As I told you, most commonly it is excess skin in the lower eyelid, excessive creasing and wrinkling in the lower eyelid, and most commonly puffy eyes or under eye bags. What are these under eye bags? Nothing but the excess fat which is deposited underneath the skin. And these fat bags are usually spread into the entire area underneath the eyes. Now there are two types of lower eyelid blepharoplasties, or two approaches to it. One is where we make a fine cut just underneath the lash line on the outside, whereas there is another incision that we make where we go from the inside of the eyelid and we make it. Let me tell you again, this is not an internal surgery. We are only dealing with the eyelid skin and the fat which is right underneath the eyelid. We do not go internally into your eyes. So the common incision that I make is the one which is below the lash line. It is in the existing crease that you already have, and through that we measure the amount of excess skin which is there in the under eyelid, and then we also remove the excess fat. For some people, we make sure we restrict the amount of fat that we are removing, because otherwise post-procedure they develop a severe hollowness under the eyes. So what we do is sometimes remove excess fat, or sometimes use the fat from the sides and actually move it towards the inner side. So that in the other hand also takes care of this deformity that we sometimes get here known as the tear trough deformity. Usually there is always a mild hollowness seen in the inside of the eyes, and most people come for fat grafting or fillers. So in a lower eyelid blepharoplasty, we use the existing fat bag sometimes from the side and move it towards the center and actually take care of the hollowness. At the same time, move this excess skin, remove it, and tighten up the lower eyelid skin. The eyelid surgery can be performed under local anesthesia with a mild sedation, or even general anesthesia, and we decide depending on how comfortable you are. But I personally prefer doing it under local anesthesia with a mild sedation. This helps the surgeon to assess how much of excess skin and fat to take out. We can also make you sit up during the procedure and actually help you see your before and after changes. We can easily figure if there is any mismatch and try to readjust at the same time, because when you're under general anesthesia, then we can only see the result after the procedure. So I prefer to do it under local anesthesia. It is a daycare procedure. You come in the morning, it takes about 45 minutes to 1 hour, and you can go home the same day. After the surgery, in an upper eyelid blepharoplasty, we have stitches which are inside the skin, and there will be a tiny stitch at the side which I will take off in about 5 days. In the lower eyelid, we just put 2 or 3 very fine stitches on the outside which are hardly visible. I usually put tapes on the upper eyelid as well as the lower eyelid, and these tapes are kept for 2-3 days. They help to reduce the swelling. They also help to give a little mild compression. We usually advise all our patients to do a lot of icing around the eyes. Commonly we see the bruising and swelling to be for about a week. In a few patients who have thicker skin and darker skin, we do not see much of the redness, and the swelling usually tapers off gradually. We provide you with pain medications, antibiotics after the procedure for about 5 days, and this helps to heal the wound. Infections are really not seen in an eyelid surgery, as it is a very external surgery. So this was just a brief explanation of upper and lower eyelid blepharoplasty. If you're looking to watch more videos on eyelid surgery or other cosmetic procedures, do tune in to our YouTube channel, Drkarishmaaesthetics, and watch out for more videos. Do not forget to press the bell icon below and subscribe to us right now.